Welcome back, aspiring medical coders. The stakes are getting incredibly high as we jump right into part 94 of our 100-part CPC exam series. Today, we're tearing down advanced HCPCS Level 2 coding guidelines. And let me tell you, mastering the math, the exact drug dosages, and the super strict compliance rules we're about to cover, it's an absolute game changer. These are literally the exact traps that trip up countless test takers, but by the end of this explainer, you're going to be navigating them like an absolute pro.
But hey, before we get to the really good stuff, make sure to like, share, and subscribe to Decode Healthcare with Harshal. It honestly helps us keep creating these deep dive explainers just for you.
Okay, let's dive into this. Here is today's CPC Masterclass blueprint. We're hitting the HCPCS overview, J-code math, ambulance matrices, vision and hearing, and finally, a Level 2 modifiers deep dive.
Starting with number 1, HCPCS overview. CPT versus HCPCS Level 2.
So, you might be wondering, what's the big difference here? Think of it like a giant puzzle. CPT codes represent the service, right? What the provider actually did. HCPCS Level 2 codes, on the other hand, represent the supply that made that service possible in the first place. We're talking tangible things like durable medical equipment, transport services, and specific injectable drugs. Mastering your exam means knowing exactly how to bill for these specific quantities and understanding the strict rules that payers enforce.
Let's move on to number 2, J-code math and injectable drugs.
For codes in the J0120 to J9999 range, which cover your injectables, biologicals, and oral chemo agents, please never just bill one unit simply because there was a single injection. No way. Here is your masterclass formula to avoid that trap. Step 1, check the unit descriptor in your manual. Step 2, divide the administered dose by that exact descriptor. And Step 3, bill those calculated units.
And this brilliantly illustrates how that works in practice. Imagine a patient gets 50 milligrams of a drug. You look up the code, and the descriptor specifically says per 10 milligrams. Okay, so you just divide the 50 administered by the 10 in the descriptor. The result? You must bill 5 units on that claim. If you only bill 1 unit, you literally just lost the practice 80% of their reimbursement.
But what about drug wastage? Do not fall for exam tricks here. Modifier JW is appended to report the exact amount of drug wasted or discarded from a single dose file. On the flip side, modifier JZ is mandatory to report when absolutely zero drug was wasted from that container.
Section 3, ambulance matrices, A-codes, and transports. Looking at the A0021 to A0999 range, ambulance billing requires pinpoint accuracy. Service levels escalate from basic life support up to ALS-1 and ALS-2, which is advanced life support, all the way to specialty care transport. And here's a massive exam tip for you. The documentation of emergency versus non-emergency directly drives your base code selection. You have to read those exam vignettes incredibly carefully.
Now, what's really interesting about this slide is how ambulance claims require a highly specific 2-character modifier matrix. The first letter is always your origin, and the second is the destination. For example, an R for residence and H for hospital combines to make RH. Reverse the trip, it becomes HR. You might also see D for diagnostic facility, N for nursing facility, or P for a physician's office. You're basically mapping the exact physical journey of the patient for the payer.
Jumping into number 4, vision and hearing services are V-codes. These ranges cover your auditory and visual supplies. The V2020 through V2799 series covers vision. Everything from standard frames and single, bifocal, or trifocal lenses to contact lenses and complex ocular prostheses. Then the V5008 through V5364 series covers hearing. This includes the initial hearing screening tests, the actual hearing aids themselves, and the fitting and dispensing services.
Section 5, Level 2 modifiers and our compliance deep dive.
In HCPCS, missing a modifier often equals an instantly denied claim. Anatomical precision modifiers are absolutely crucial here for exactness. You can't just bill for a procedure on a finger, you have to specify exactly which digit using FA through F9. The same extreme specificity goes for eyelids with E1 through E4, coronary arteries like the RC, LC, or LD branches, and of course your standard left or right side with LT and RT.
Then we have the ABN, or Advanced Beneficiary Notice modifiers. Let's lock these in with some memory anchors. GA means a signed ABN is on file for a service you expect to be denied. GZ, that means 0 ABN was signed. GY is for a service statutorily excluded by Medicare, and GX is used when a voluntary ABN is used for those statutorily excluded services.
So ask yourself this: why is mixing up GA and GZ such a massive compliance risk? Well, because financial liability shifts completely based on those two little letters. If you use GZ, the provider expects a denial but fail to get a signature, meaning they legally cannot balance bill a patient. The clinic just absorbs a loss. CPC auditors love testing you on this because it directly impacts revenue.
Wrapping up with number 6, the final cheat sheet and exam prep summary.
So, the crucial point is, you're going to want to take a screenshot of this summary right now. It consolidates your essential J-code math formula, the ambulance origin and destination logic, your exact V-code ranges, and those vital ABN liability mnemonics. Keep this cheat sheet handy. It is pure gold for your final exam prep.
But listen, knowing the rules is only half the battle, right? What happens when a single, complex case study throws multiple wasted drug dosages, a statutorily excluded service, and an ALS-1 ambulance transport at you all at once? Will you know which modifier actually takes precedence? We are going to tackle exactly that in Part 95 with our High-Yield Practice Masterclass. Until then, keep studying, keep practicing, and I'll see you in the next explainer.